For the past few weeks, we've been talking with Dr. Jason Leedy about different forms of plastic surgery. Most are not covered by insurance, but today we're going to talk about a type of procedure that can really change the life of a woman, and we're talking about breast reduction. Dr. Jason Leedy is a plastic surgeon, joins us again. Good to have you back on the show.
Nice to be here.
Okay, breast reduction. Obviously, we're making the breast smaller. A lot of back pain comes along for women, but how do you decide how much of the breast you're going to reduce in breast reduction?
Well, first of all, breast reduction surgery is a wonderful procedure for patients that would benefit from it. People just don't realize how uncomfortable it is to walk around with heavy breasts all day long. And it's something that people are often reluctant to pursue. They've thought about it for years, and they finally decide enough's enough. I need to investigate this. And heavy breasts will cause problems with back pain, neck pain, grooves in the shoulder, and rashes in the fold. But you know, if people have those problems, then they may benefit from a breast reduction. And when doing the surgery, it is covered under insurance if they meet certain criteria. However, the volume that we remove is in some ways determined by insurance. They require that we remove approximately a pound per side, which works out to 400 grams. That usually is the very minimum that we remove. Often it can be up to 2,000 grams per side, so 5 pounds per side. So this is a major life-changing surgery for people that would benefit from it.
You talk about some of the problems and complications that women who have larger breasts suffer. Are those problems reversible, or is the damage already done?
No, it's remarkable. I mean, they're new people after the surgery. They notice in recovery. The first time they get up to walk to the bathroom in recovery, they notice that I don't have that weight on my chest anymore, and their neck feels better, their back feels better. It does take time for them to recover from the surgery. Usually after 2 weeks, people can get back to work, and there's still some swelling to the breast, but after a month, 2 months, they're back to normal activity, and the world's open to them. They can do more things that they were just never able to do. How
exactly does it work in the surgery room, and where are you making an incision, and are you vacuuming out fat, or how does it work?
No, it's not liposuction. You actually remove the tissue. The surgery is designed to preserve blood flow and sensation to the nipple. That does require a certain there's different techniques to do that, but basically the excess tissue, the tissue that hangs below the fold, is literally removed. The breast then is reshaped. And you asked about how much do you take out. The goal is to remove the extra weight that's causing the functional problem, but it's also, in my opinion, to create a shape of the breast that's appropriate for that patient. Now, everybody has a different shape and size, and in some women that may be a C, some may be a D. Still, they leave the surgery with much improvement in their overall condition, and they have a nicer shape that fits their frame.
You know, it's interesting, whenever I have a conversation, or women have a conversation about whether it be breast reduction or breast implants, inevitably they talk about having kids and wanting to do either or after they've had all of their children. Is that something that you recommend, or can you do this in between having children?
Well, often it's best to finish having children if you have things planned, and then pursue the surgeries, because the kind of changes that occur with pregnancy affect the breast in ways that are difficult for the surgeon to control. So, but once they're finished, then you can go ahead and do the surgery, and the results will be more permanent that way.
Now, breast reduction is covered by insurance, but breast lifts aren't. Correct. After breast reduction, do many patients also need a breast lift?
No, not at all. They're different types of procedures. A breast lift is a cosmetic procedure designed to rejuvenate the shape of the breast, remove some extra skin. It's not intended to remove a large volume like as in a breast reduction. So they're different procedures entirely. Same types of incisions and scars, though.
All right. Well, if this is something that you're thinking about, you probably have some personal questions of your own. You can contact Dr. Jason Leedy at Cleveland Plastic Surgery Institute. The phone number is 440-461-6100, or you can log on to the website, drleedy.com. Stay with us. We'll be right back with much more of Good Company. We're going to be talking with pet psych.